Welcome back. I'm Mabel John. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. In our studio right now, we have Rachel Start, who is director at Rush Oak Park Hospital, which at Rush Park, they really do try to combine the convenience of the personal touch of a community hospital with the technology and expertise of a major medical center. Rachel, thank you so much for your time today. Yeah. You've highlighted the impact of nursing and why that's really vital to the ambulatory environment. Can you give me some details about that?
So I've been working with the American Academy of Ambulatory Care Nursing since 2013 to develop nurse-sensitive indicators, which are quality outcomes specific to the impact of nursing practice on patients. And the ambulatory setting is really where all our patient volume is going. It's shifting away from the inpatient setting. We know that it's down about 7% between 93 and 2013, and then it's up near 20-30% in the outpatient setting. What we're trying to do in healthcare, and with even healthcare reform since 2010 and even before, is shift patients to more of a health promotion, health prevention, disease prevention process. And that is best done by folks that know a patient for the length of their lifespan. And that is our nurses in ambulatory and outpatient settings, in community settings, public health centers. Those, we can have a lot of impact for a quick visit or a quick episode, even virtual or telephone health, can talk to somebody, help them with what symptoms they're having, help them with safety at home, and really keep them out of the inpatient setting, which is costly. It's not as safe for patients. And so as healthcare shifts from a mentality of a 3 to 4 day episode in the inpatient where we just look at the one problem that they presented with, to a focus of let's look at your lifespan, let's help you live longer, let's help you be healthier. We need ambulatory nurses within the interprofessional team to really leverage their discipline and what they know about education, care coordination, symptom management, as well as healthy living. We need those nurses to really be empowered to practice at top of scope. In this moment right now in healthcare, that will help fix a lot of our dysfunctions in healthcare.
Are you finding that the reception to these ideas are positive?
Yes, we have had support from many organizations across the country, and really globally there's a lot of outpatient ambulatory nursing that's strong. But within the U.S., ever since really the Future of Nursing report that was issued by the Institute of Medicine in 2010, which was actually a response to healthcare reform, it was a landmark document that we all really cite, that was funded by Robert Wood Johnson. Is now there's key demographics that we're all trying to meet that you can follow in the Campaign for Action. That document stated that no matter where a nurse works, if we're really going to realize more equitable care across patient populations, better quality, better care coordination, it's the nurse that is at each of these settings throughout the care continuum that we really need to leverage. And that document outlined a couple barriers that nursing has related to top of scope practice, that they're not always practicing at top of scope, that they don't always have higher levels of education to give them the foundation for this, and that they're not always valued partners in the interdisciplinary team. So when we had that report, it's given a lot of us in nursing leadership the leverage to make changes because it was done from such an authoritative body.
Right. What can people do to really advance this and be a part of the transformation?
So really what we're working a lot on is the collection of nurse-sensitive indicators. So identifying those things within an outpatient setting that are sensitive patient outcomes to an impact that a nurse has made. And so we are here presenting in the next hour on how folks can be a part of that pilot process. We are just underway with pain assessment and follow-up. In June, we're starting hypertension and falls risk screening. After that, we will take up BMI as well as depression risk screening, and then we will look at some more complex indicators such as patient engagement. So we have 140 organizations across the country that are a part of our pilot process and technical expertise panels. If they have interest in helping to move that work forward, they can contact myself or the American Academy of Ambulatory Care Nursing or Collaborative Alliance for Nursing Outcomes.
Okay, very good.
Yeah.
Rachel Starr, thank you so much
You're
for your
welcome.
time today.
Yeah.
And I'm Mabel Jong. Thanks for watching.